All right, so in this demonstration, we're going to take a look at a smart assisted living facility, or you might call it a smart nursing home. And in this smart nursing home, we have a number of things that are going on. So for example, here, we can see that the system uses the current location and pulls all the weather information for the week so that it can help plan what the residents are going to potentially do or have access to. In fact, here is the first place that we engage with a large language model to use the current weather, the age of the residents in the nursing home, to recommend a set of activities. And so this goes through the process of combining, again, resident data, weather data, and all of the relevant information like location data to provide a summary of activities. Here you can see it recommends a number of indoor activities based on scattered clouds, broken clouds, and overcast clouds. So we see we've got a number of rainy days here, and then we've got our clouded activities that we see here. We've got outdoor activities for the clear sky that might come up. We've got visitation recommendations and so forth. And then it says remember to consider the individual needs and preferences of residents. So a very simple task, but a way of combining all of the relevant data into a unique situation of interest. Next, we'll start diving into some of the real-time streams of information. Now, in this nursing home, each resident has both a wrist-worn device that measures vital sign information. And here we can see that Thomas must be a new resident because there's no data for his device at all. The system, though, continually checks to see what's going on with which residents and which devices. So, for example, we see here that all of a sudden we've got a new alert that's come into our dashboard. And it says, for this resident, for Francis Moore, data has not been seen from the device for over 12 hours. So when we drill into one of the records for the patient, we can kind of see what the last readings were, but we can see that these readings are considerably out of date. So this is a warning to us that to do all of the things that we're going to want to be able to do to identify specific issues, for example, like clinical deterioration, these vital sign readings must be current enough to warrant generating the clinical risk from body temperature, respiration, blood oxygen, heart rate, and of course, blood pressure. These first two pieces of information about whether there's no data or whether the data is stale is important to be able, for real-time data as it comes through the system, to be able to generate that clinical score. And that's the next thing that we'll take a look at here. As new data comes into the system, it automatically generates a clinical score, what's called a news score, to look at potential clinical deterioration of one of the residents, which might indicate they need to go immediately to the hospital. So here we see a new risk has popped in, and this one is much more severe than the first two. The first two are missing data, but of course we need this data to be current to generate this third one. And here we see, unfortunately, Margaret is showing it an elevated clinical risk of 7. You'll also notice that the map is reoriented to show what building Margaret lives in. She lives in a building called Serene Haven, and she's in room 107. And the map's oriented so that we know where Margaret is at the time that this new reading came in. We can take a look at that information by drilling down onto that record. So here we can see she's got the clinical risk of 7 based on these physiological parameters. So what's going on here? Well, we can actually look at some of the detail to see how that news score was calculated. So, for example, because this patient is on supplemental oxygen, she automatically gets a score of 2. Her respiration is out of line, and she falls somewhere in the respiratory rate, 21 to 24, so she gets a respiration score of 2. Her systolic blood pressure is very low. She gets a score of 3 for an overall risk of 7. That puts her at high risk of clinical deterioration, and likely she probably has a lot of things that need to be looked at and likely needs to be treated in the hospital. This is where we can also engage with the large language model in combination with fine-tunings from a vector database that's been trained on thousands of pages of clinical material. So here, all of the information was generated by the LLM in the vector database. And it does a brief summary. It gives the basic patient information. We've got a 90-year-old female. It has her resident or patient history. She's got congestive heart failure. She's got ejection fraction of 32%. She's on the drugs Corrigan Lasix. She is on supplemental oxygen. She does have this new score of 7. And then it gives all of her vital readings. The immediate next steps would include assess overall condition and clinical symptoms, consider further diagnostic tests and imaging studies, evaluate a response to current medications, Corrigan Lasix, and consider adjusting the doses and adding additional medications, monitor oxygen saturation closely and consider increasing the supplemental oxygen, assess fluid status and consider adjusting the diuretic, Lasix dosage to optimize fluid balance. So it's got a full set of steps. Now, all of this data was generated by pulling data from the semantic index, from the vector database, and applying it with the LLM. We can actually look at the references that were used and then show the specific places in the text that were used in the referenceable material that was used to identify those specific recommended next actions. Last thing that we'll show the demonstration today is some of our residents are recovering from postoperative surgery, and they should not get out of bed unassisted. To that end, we've implemented a combination of real-time streaming data from a pose estimation model to alert us to when a resident might be trying to get out of bed on their own, which creates a significant increase in their likelihood of falling. And so what we want to do is send notifications to staff that this patient is trying to get out of bed and they need assistance, and at the same time prompt the resident to stay in bed. Here on the screen, you see the pose estimation engine calculating the body position, realizes that she's now transitioning into a upright state, and prompts her to get back into bed.
Please don't get out of bed. Someone will be with you shortly to assist you.
On the mobile phone, you'll also notice we've got an alert, fall prevention. Your patient's trying to get out of bed. All of the necessary information is sent to the mobile handheld so that the staff who needs to know about this information, that a patient or a resident is trying to get out of bed, needs help and assistance. At the same time, if the resident continues to try to get out of bed, the system will continue to prompt her to go back into bed. At the same time, ruling out false positives from just simple movements inside the bed. But again, here she's trying to get out of bed.
Please don't get out of bed. Someone will be with you shortly to assist you.
And the system will continue to warn her to go back into bed. Also, the alert has been sent to the dashboard, and the map has been updated accordingly, so we know exactly where this individual is, specifically where she might be trying to get up and where she needs assistance.